Really cool story for you. Something that not everyone might know, but as physical therapists, we actually treat the temporal mandibular joint. The condition that's common that gets referred is TMD, temporal mandibular disorder. These patients, it's very debilitating for them. They basically can't chew food. The patient I'm thinking of right here for the clinical story, she had 9 to 10 out of 10 pain when she was chewing food. She basically didn't chew food. She would eat a lot of liquid type of foods or blend foods up. It sounded absolutely awful. I felt terrible for her. Pain just with talking too, because she couldn't open her mouth very wide because it was so stiff and because of this condition. She also had migraines. We started by just looking at neck range of motion. We also looked at range of motion of the jaw. So we looked at how wide she could open and then side to side movement, all the different movements forwards and backwards. Then we looked at how each joint moves. She had some discrepancies of how much each joint could move. She had some popping and clicking on one side, very common for TMD. We started by giving some basic exercises for retraining that jaw, how to move symmetrically. She had deviations with basic jaw motion. Then we did some basic releases of the muscles. We also did some intraoral releases, some muscles in the mouth and behind the jaw a little bit. Taught her how to do that. She got instant relief with those, which was really cool. She reported a 50% reduction in symptoms by doing some trigger points to the muscles inside of her jaw and massaging some of her main muscles like the masseter on the side. Really cool. Also gave her some basic stretches to reduce her neck tension and start regaining mobility in her neck, since she literally could only move her neck like this. That's not normal. Yeah. After doing some of that basic stuff, she came back to me reporting a 50% reduction in symptoms. She was saying anywhere from 5 to 7 out of 10 pain now. Pretty big difference. She wanted to then try dry needling therapy. We tried dry needling. We went in and targeted some of those muscles and the joint. We actually tried to shoot some of those needles into that joint space. She came back after progressing those exercises and doing the dry needling, and significant reduction in symptoms yet again, kind of bringing her down to that between 1 and 4 out of 10 level pain, which is awesome. She's starting to chew, take small bites, and starting to chew food again, very cautiously, but huge progression in the right path. We keep doing the dry needling, start doing some thoracic or upper back mobility drills, really trying to strengthen up the neck, do a little bit of postural muscles, trying to decrease tension on that jaw joint as much as possible. Forward a couple of visits later, she's all the way down to a 1 out of 10 for chewing chewy objects like steak. She really loved bagels, so that was her reward to herself, getting a bagel and only having a mild discomfort after, and having a great exercise routine to let that joint continue to heal. And yeah, I don't have any doubts that she'll get down to that 0 out of 10. Difficulty with chewing like chewy foods, it's kind of like sport therapy, where we had to do some education on small bits of steak and bagels at a time, building up to a whole bagel and steak, kind of like a return to sport, where maybe you start doing small jumps and cutting drills a little bit at a time, and then you increase the height, the intensity of those drills. Cool, super cool to apply those same physical therapy, joint and muscle rehab approaches to something as unique as the jaw.